Utah.gov/free.
Police have verified a social media post from one escapee and raided an apartment after tracing it back to the video post.
In a blue sweatsuit, the man claiming to be Antoine Massey acknowledges that he's likely to be recaptured.
When I get back in custody, I'm asking y'all please to come help.
When, not if, he's back in custody. Police who raided an apartment not far from the Orleans Parish Prison found a sweatsuit, but not Antoine Massey. He and Derek Groves are the final 2 of 10 inmates who escaped from that jail last month. Jim Ryan, ABC News.
House Republicans ramping up their investigation of what they've labeled President Biden's mental and physical decline while in office. The House Oversight Committee chair asking several top advisors to testify.
The letters have been sent to 5 senior Biden aides, former Chief of Staff Ron Klain, and top advisors Anita Dunn, Mike Donnellan, Bruce Reed, and Steve Ricchetti. House Oversight Chair James Comer says he seeks to know who made key decisions in the administration, and he's demanded the aides appear for transcribed interviews. Last year, the Biden White House rebuffed similar requests Comer made to have 3 other senior advisors and Biden's doctor answer questions. Comer has now renewed his request and says he'll issue subpoenas if they don't voluntarily appear. Stephen Portnoy, ABC News, Washington.
The USDA Food Safety and Inspection Service issued a public health alert for ground beef products over concerns it may be contaminated with E. coli. The raw ground beef sold in 1-pound packages produced by Organic Rancher between May 22nd and May 23rd. Michelle Franzen, ABC News.
Progressive presents Employee of the Month. Small Business Edition. Today's recipient from Michaela's Mobile Spa, Michaela. Michaela got a quick business insurance quote from Progressive and chose from over 30 customizable coverages. Sure, it helps she's her only employee and does literally everything. But while others would rest on their laurels, Michaela was hard at work saving big. So take that, hypothetical other employee who doesn't exist. Be your own Michaela. See if you could save in as little as 7 minutes at ProgressiveCommercial.com. Progressive Casualty Insurance Company and Affiliates. Coverage is not available in all states or for all vehicles and coverage selections.
Talk 610 AM and 102.1 FM. KVNU.
It's time to take a look at this hour's news headlines here on KVNU. I'm J.D. Walker. A man was arrested after agents found him in possession of more than 10,000 fentanyl pills in his car and at his home. Edwin Hurin Marcis, 31 of Mexico, was arrested on suspicion of attempted trafficking of fentanyl or fentanyl-related substance, a first-degree felony. He later admitted to residing in the U.S. illegally, according to the affidavit. In June 2025, the FBI task force, along with the Davis Metro Narcotics Strike Force, conducted a criminal drug investigation into the Mexico-based drug trafficking organization. Agents say they identified the local drug redistributor as Marcis, working for the drug trafficking organization in Utah. On June 2nd, agents conducted a traffic stop on a vehicle after a known drug deal. The man was the only occupant in the vehicle. Agents searched his car and found approximately 10,000 fentanyl pills under the passenger seat in a black bag. The man allegedly admitted to possessing the fentanyl pills in his vehicle and said he distributed them for cash profit. He also alleged that he had more fentanyl and heroin at his home and provided consent for agents to search. Agents found a distributable amount of heroin and fentanyl pills, the affidavit states. He was booked into the Salt Lake County Metro Jail. It's been a year since the Church of Jesus Christ and Latter-day Saints began releasing batches of the new hymn book. Now the final edition is planned to be printed by mid-2027. The church announced Tuesday, June 3rd, the new hymn book titled Hymns for Home and Church is expected to be printed in up to 50 languages and feature about 375 songs. The plans to create the new hymn book were first announced in 2018, with church leaders asking members to send in original songs and fill out a questionnaire regarding the church's music. Church leaders reported that more than 17,000 songs were submitted. The process to comb through the submissions and feedback took about 6 years, and in 2024, the church started releasing the new hymn book in sections. There have been 37 songs released online so far, a mix of hymns and children's worship songs. The completed printed hymnal will not be available for another 2 years, but church leaders are encouraging congregations to use the released hymns now. And finally, the Associated Chief Justice John Pierce has announced his department from the Utah Supreme Court Friday in a letter to the governor. Pierce gave 6 months' notice, saying he plans to depart in December, making 10 years of service to the Utah Supreme Court. According to the court's record officials, he's served as the Associate Chief Justice since 2022. Pierce wrote that it's time for him to come to turn the page and start a new chapter in his career and find new ways to serve the people of Utah. Pierce says he's given 6 months' notice to keep with the transition of not leaving until the governor appoints his successor. Governor Spencer Cox will pick the next justice from a list of 7 candidates chosen by the appellate nominating committee, and the state Senate will then need to confirm the appointment. Chief Justice Matthew B. Durant said Pierce's contributions have been truly extraordinary. After 16 years of public service, Pierce plans to return to private practice. He will also continue to teach at the University of Utah. A look at your weather this hour brought to you by Logan Extermination. They can help you get rid of all those creepy pests. Call them today for your service. Sunny and 74 today, mostly clear tonight with a low around 46. And that's been a look at your news for this hour here on KVNU. I'm J.D. Walker.
Today's hearing aid technology can improve not only your life, but the lives of the people who care about you. Once again, you'll be able to hear the reason for their laughter and understand conversations. Dr. Paul Danes will customize a hearing improvement program to meet your unique requirements, whatever they are. Call Dr. Danes for an appointment at 753-HERE and let him show you how.
Bring back what you've been missing. Bring back Cache Valley Hearing and Audiology.
News Talk KVNU.
When it comes to home care, it's important to know you have a choice. If you or a loved one is in need of hospice or home health services, remember that Primrose Home Care and Hospice believes in treating the patient as well as the problem. We work directly with you and your doctor to create a health plan that's catered to your needs. Our team is devoted to providing options in the freedom and safety of your own home. Visit us at primrosecare.com or call to schedule a free consultation. Primrose Home Care and Hospice, your local hospice and home health provider since 2006.
On the next Handle on the Law.
How about this? What if I run for president and I say I'm the best one, and I have a radio station and I talk to millions of people? So, Tim, by the way, I still don't know how to spell your name because I don't care. I'm running for president. Here's how to spell my name. How?
Saturday afternoons from 1 to 4 on News Talk KVNU, 610 AM and 102.1 FM, the voice of Northern Utah.
KVNU's For the People with Jason Williams and Bill Walter.
And it is Utah known as the fraud capital of the world. Not because we have more people committing fraud, but because we have so many people falling for it.
Going beneath the headlines and connecting you to the newsmakers.
The radio is a great way to get the word out to a lot of people in an emergency. So we thank you for your help and being a partner with us.
For the People on News Talk KVNU, 610 AM, 102.1 FM, online at 610kvnu.com and on the KVNU mobile app.
Welcome to KVNU's For the People. It is Wednesday, June 4th. I'm Jason Williams. Thank you for tuning in. Cache County Executive David Zook joining us in hour 2 of today's show at 5 o'clock for our monthly county hour. We had to skip this last month due to some scheduling issues and it just being generally really inconvenient for the county executive schedule to get in. So we'll have kind of a double update today. He says he's got a lot of information to share. So the county hour with Cache County Executive David Zook next hour as we move through the show today. Quick announcement for those looking for something entertaining to do. A little over a week from today, June 12th through the 14th at the Cache County Event Center and Fairgrounds, Summerfest gets underway. A big annual event that draws crowds from all over Utah and southeastern Idaho. In fact, I know some folks who actually travel from Boise because they have a booth at Summerfest every year and say they wouldn't miss it. So the event kicks off June 12th and goes until the 14th, but with just a little over a week to go, they're looking for volunteers still. So they're asking the community, anyone out there who is interested to step up and help them out and join as a volunteer for the Summerfest Arts Fair. Promo they've been putting out there is that they have a lot of different roles, so anyone can find a spot, regardless of what your interests are or your abilities are. They have a lot of need, and they're literally begging. So they're asking for individuals and groups. If you'd like to volunteer as a group, maybe your neighborhood, maybe a church group, maybe a school group, something like that. They're asking that you reach out to them. Go to logansummerfest.org/volunteer or logansummerfest.org and click on the volunteer link there for information on how you can help them pull this off another year. So Summerfest Arts Fair seeking volunteers for next week's Summerfest event kicking off June 12th. And again, they are desperately in need of some extra hands. So one more time, logansummerfest.org/volunteer for information on that. No deadline given on, when registration or the opening ends. I'm pretty sure, based on what some of the organizers have told me, they will take people up until day of because they're very shorthanded this year. So coming up later on this hour, it's been in the news quite a bit, artificial intelligence, over the last several years, but really kind of ramping up this week as news broke and surprising a lot of Republican lawmakers in the U.S. House, which kind of rams home the point that both Democrats and Republicans, whether they're in the majority or the minority, oftentimes have no idea what they're voting on. Because a lot of the people upset about an AI provision in the budget bill, and I'll say that again, an AI provision in the budget bill, something that has nothing to do with the budget, they voted for the bill. It passed the House by one vote, and several of the people squawking about this AI measure that was tucked into the bill quietly did vote yes, and it's brought AI back to the forefront. So with that in mind, Nick Dunn and crew this week for the Defending Ideas episode decided to tackle that topic. The provision in the House bill is one that basically, so much for states' rights, right? It's a provision in the budget bill that has now passed the House and is still kind of rolling around in the Senate with a goal of getting something passed by July 4th. This provision in that federal bill says that states can't regulate AI. And I tell you, someone with deep pockets got to someone else, because I can't imagine why they would do this otherwise. It's a nonsense provision, and hopefully the Senate, lets cooler heads prevail and strips this out. Basically, that would mean, so Utah has put a few guardrails in place, some very simple rules when it comes to using artificial intelligence to create fake videos and use it for advertising against your competitors and things like that. Also, anything with malicious intent towards an individual, deep fakes as they're known. If you create a video meant to malign someone else using artificial intelligence here in Utah, that is a felony. Those rules would be out the window. Because this, tucked into the federal budget bill being debated, this AI provision says states can't regulate AI, period. Any state rule regarding artificial intelligence is null. I really hope they strip this one out. So Nick Dunn this week sits down with Naomi Lopez, founder and principal of Nexus Policy Consulting. This is a group that specializes in helping to inform lawmakers on tech-oriented, state-based public policy. So they'll be discussing the ramifications of artificial intelligence at large with this in mind. So a sneak peek for our listeners of this week's Defending Ideas coming up later on this hour. Last night, Utah House hosted and live streamed, though I can't imagine who was watching this from home, the House leadership elections. And there was really no surprises, but some changes. The House Majority Whip will now be Representative Bridger Bolender from Grantsville. House Majority Whip is Representative Candace Pierucci from Riverton. Bridger Bolender from Grantsville will be the House Majority Assistant Whip. And our own, from right here in Cache Valley, Representative Casey Snider, ticked up a bit. He had served in leadership in a minor role in the last session for this upcoming 2026 session and the interim sessions that will happen between now and January. Representative Casey Snider from Paradise will serve as the House Majority Leader. This is basically second in command. This is traditionally a role that is given to someone who, when the current speaker retires or steps down, or as has happened here in Utah, leaves office in scandal, the majority leader then steps up and is elected by the House as a Speaker of the House, which is basically the third most powerful position in Utah after the Senate President and the Governor. So I don't know if Representative Snider has those aspirations, but he is in line should he choose to one day run for Speaker of the House as a representative. I believe that would make him the first Speaker of the House from Cache Valley, at least as far back as I could find. I was able to go all the way back to the 1960s, and I wasn't able to go back further than that. For some reason, the information about House Speakers cuts off in 1960 or at 1964. I couldn't find any information before then listing names and locations of Utah Speakers of the House. But all the way back to 1964, at least, there hasn't been a Speaker of the House from northern Utah, from Cache Valley. And so, again, I'm speculating here. I have not spoken with Representative Snider, haven't asked him this question directly, although I will next time he's in. But if he does have aspirations to be Speaker of the House, and I would guess that job's not going to be open for a bit. Speaker Mike Schultz is new, and though it's been rocky for him, and personally I don't think he so far has proven to be one of the greater speakers of the House. He's a bit reactionary, and that can sometimes hold you back as a leader in the House. It causes the caucus to get jittery, the majority caucus, if the speaker is kind of knee-jerk, flies off the handle sometimes, at least on social media. But for all the talk of Twitter not being the real world, when it comes to these types of things, colleagues on the Hill do notice, and so a few tweets he's had to delete or apologize for have kind of held him back as Speaker of the House. So, again, tea leaf reading here. There's a chance he hates the job, decides that it's not for him, resume or stays in the House as a representative, but steps down as Speaker sometime after the next session in 2026, and that would leave the spot open for whoever wanted to run. And that is traditionally in Utah the House Majority Leader. And again, Representative Casey Snider is now the House Majority Leader after last night's elections. All of this is speculation on my part. Again, I don't even know if Representative Snider has such aspirations to be Speaker of the House. I don't know why anyone would want to be Speaker of the House, to be honest with you. I would take Senate President. I would be governor before, if I didn't have to campaign and fundraise, which I'd hate. I would rather be governor or Senate President than Speaker of the House, because it's the largest legislative body in the state, and 76 members, I believe now, 74 members, and wrangling that, herding cats is an understatement. And the House, with them having to run for re-election every 2 years, they actually only have 1 year that they work. The next year they're campaigning through the legislative process, unfortunately. So, again, I don't know if Representative Snider has such aspirations, but if he does, the route was cleared last night as he was elected by his colleagues to be House Majority Leader in the legislature, which is second only to Speaker of the House, the person who drives the show each session. So congratulations to Representative Casey Snider. This is good for Cache Valley. This is good for northern Utah to have people from this part of the state instead of just the Salt Lake, Utah County area kind of dominating leadership as too often is the case. I'm glad to see someone from Cache Valley at least moving up through the ranks. And to be fair, representatives from Cache Valley do get important committee assignments on the regular, but this is actual leadership, meaning they can decide a lot of the agenda. They can decide a lot of what bills are heard and not heard in the first place. They can discourage lawmakers from running certain things or encourage them to run others. And so it's a pretty important thing. So, again, congrats to Representative Casey Snider from Paradise, new House Majority Leader, second in command to the Speaker of the House, Mike Schultz from Hooper. And we'll see what Representative Snider does with this. He's a good guy. We'll be back with more For the People right after this.
News Talk 610 AM, 102.1 FM, KVNU.
Mountain Valley Heating and Air Conditioning wants to help Cache Valley feel the love. Mountain Valley Heating and Air is giving away 5 fully installed heating and air conditioning units free of charge. Go to mountainvalleyhvac.com and help make a difference one home at a time. That's mtnvalleyhvac.com. Nominate prior to September 1st, 2025. See website for all details.
First impressions are usually the most striking, which is why your landscape should leave a lasting impression. But the right landscape can be tough to create, unless you know the right people. Only Canyon Landscaping knows what it takes to make a property stand out. Their goal is simple: to ensure total client satisfaction through the highest quality landscape. And right now is the perfect time to install or upgrade your landscape. Call Canyon Landscaping at 752-3838. That's 752-3838. Canyon Landscaping. Look for the leaf.
Even if a family member has or had dementia, it doesn't mean you will. Dementia affects the brain and your ability to perform daily activities. Lifelong learning will keep your brain healthy and can reduce your risk of dementia. Engage your brain through hobbies and learning new things. For more brain health tips, visit dementia.utah.gov. This message is brought to you by the Utah Alzheimer's Association and Alzheimer's Disease and Related Dementias Coordinating Council.
Hey, Sean Hannity here. It is critical we keep AM radio in all cars and all trucks. Text AM to 52886 today.
Standard message and data rates apply.
Hi, it's Olivia Munn with my shelter pets, Frankie and Chance, reminding you that when you adopt a shelter pet, you discover all the things that make them unique. Adopt pure love at theshelterpetproject.org. Brought to you by the Ad Council, the Humane Society of the United States, and Maddie's Fund.
Measles. Yay. Measles has been in the headlines quite a bit over the last several months as, somewhat large outbreaks in Texas and Oregon have occurred. And, of course, with the current Health and Human Services Secretary Robert Kennedy Jr. being in the anti-vax crowd, he's raised questions about vaccines and created discussions without evidence, of course. I don't know what to say about that other than that, but it's in Utah. So state health officials are basically saying don't panic. They don't want to create a panic about this, but take measles very seriously. And this comes after they were alerted by a family member of an individual, an out-of-state resident infected with measles, came to visit family in the region. This person was unvaccinated, and the family he visited were unvaccinated, and they all have it now. Measles is deadly. It almost always leads to hospitalization, especially in adults. And the Utah Department of Health and Human Services are sounding the alarm about the measles case today. This is just 2 days after they were notified. They had to verify the notification. But again, an unvaccinated visitor to St. George stayed for about 4 days from May 26th to May 30th, where they visited other unvaccinated individuals in the community and went out to a farmer's market and a couple of grocery stores and a retail store in St. George. Utah Department of Health officials say while the risk is to the general population is low, they want to make the public aware because the incubation period for measles is lengthy. 10 to 14 days after you contract the virus, you develop the first symptoms. And state and local officials, though they couldn't provide any wouldn't provide any additional details about the individual specifically or where specifically in St. George this occurred, they're basically raising the alarm so that people can be vigilant and watch themselves for symptoms in the St. George area. So they're directing people with symptoms call medical facilities and provide staff with advance notice before coming to the hospital, if you can, and or clinic, in order to protect other patients from exposure and to also avoid a full-on outbreak of measles in Utah, like what is currently happening, through most parts of Texas, at least the urban areas at this point. So the case is the second known possible measles exposure in Utah in recent weeks. A person traveling from Canada with an active measles case landed in Salt Lake City on May 19th. That made headlines. And then drove from there to Idaho, and then drove back to Salt Lake City on May 23rd and flew out. The state health department said there were no reports yet of anyone who became infected with measles after coming into contact with that traveler. Apparently, they're more concerned about this traveler because this traveler was here for a few days and did go out in the community in Texas. And again, measles symptoms typically appear 10 to 14 days after exposure to the virus, according to health officials. And state health officials said the most common symptoms are a rapidly developing high fever and cough, along with runny nose, sore throat, red watery eyes, and then tiny spots that appear inside the mouth on the inner lining of the cheeks. And then within a few days of those symptoms, which unfortunately are the same symptoms many people have this time of year due to seasonal allergies and all the pollen circulating around. But a day or two after those symptoms develop, that's when what we all know of measles, the rash with the small red spots, generally begins 2 to 5 days after the runny nose, sore throat, and rapidly developing high fever. So you might feel like you have a flu at first, or a head cold even, and then 2 to 5 days after that, the red spots develop. If you see that, you've got measles. And measles is one of the most contagious diseases on record, and even beating out the original coronavirus, COVID-19, and most often in all ages, except very young children, leads to hospitalization. But those over 30 are at risk for very serious illness, including death. So the last reported official measles infection in Utah was March of 2023. And that was a person also not vaccinated, traveling from outside the U.S., brought measles back or traveled outside the U.S. and then brought measles back. But the department didn't believe that person developed symptoms while traveling and did not come into contact with anyone else here in Utah. So basically, if you're in the St. George area or headed there or have been there, just keep an eye out. Again, the Department of Health here in Utah said don't panic. They don't have any confirmation or any reason to believe that this person has actually spread the measles, but that person is now hospitalized in another state, and they were here for 4 days, starting May 26th until May 30th, and they did go out into the community quite a bit, a couple of grocery stores and retail stores, and a farmer's market in St. George while they were here visiting. And then a general reminder from the Utah Department of Health and Human Services, get your vaccines. If you're over 50, by the way, related to this, you also want to get the shingles vaccine. And those can be scheduled at pretty much anywhere you would get a shot, including Walmart pharmacies and Walgreens pharmacies, Smith's Marketplace pharmacies here in Cache Valley. So without insurance, they are a bit pricey, about almost $300, which is unfortunate. But if you're insured, they're often free. So get your vaccines. The Utah Department of Health and Human Services reminds they do work. They are effective. The measles vaccine, by the way, has been around and been in use for about 60 years. So not much of a reason to not get it, especially when you consider that most people, again, over the age of 30, end up with serious conditions and hospitalization if they get measles. And no one needs that in the middle of the summer. So, again, this is the St. George area where this warning is going out to. They're asking the public not to panic, but to stay vigilant and keep an eye out. The earlier they learn of anyone who was infected by this unvaccinated traveler in St. George, there for 4 days between May 26th and May 30th, the faster they can control the spread if it has spread. So we'll be back with more of KVNU's For the People and get to a day late this week's episode, sneak preview of the episode of Sutherland Institute's Defending Ideas, asking an important question: should artificial intelligence play a role in healthcare? What are the risks or the possible positives of this? That's the discussion. We'll get to it after this look at the news with KVNU's filling in for Will Feel Right, Mr. JD.
Check your local news headlines here on KVNU. I'm J.D. Walker. A man was charged after he allegedly threatened to blow up the Missionary Training Center. Anthony Hamilton Berdahl, 49, was charged on Tuesday with the threat of terrorism, a second-degree felony, electronic communication harassment, a Class B misdemeanor. On April 24, 2024, Berdahl allegedly called the Church of Jesus Christ and Latter-day Saints Missionary Training Center and threatened to blow up the building. Berdahl called the information line at least 10 times with all the same messages and had the operators called them profane and offensive names. Berdahl has a history of threatening phone calls, according to the Provo Police Department. In March 2024, he allegedly called the Provo Police Department and said he would have the buildings associated with their apartment shut down and destroyed. A few days later, he said he was going to drop a nuclear bomb on the police department and the state. On June 1st, he said he was going to rip a nuclear bomb through the state and murder all the people himself and kill my 3 kids and blow up the dispatcher with a stick of dynamite. On June 24th of 2024, he alleged to rip through the police department with an AK-47. On Tuesday, Berdahl allegedly told the police department he was homeless in Mexico and needed someone to take him to Switzerland. Hopefully this man gets the help he needs. In other news, an unfortunate situation that's leading to a manhunt. A central Washington state man is wanted for murder after his 3 daughters were reported missing and found strangled to death. Authorities asked for the public's help Tuesday in finding Travis Decker, 32, who is wanted at 3 counts of murder and kidnapping, according to police in Wenatchee, Washington, about 100 miles east of Seattle. Police said it was unknown whether Decker, a former Army soldier with extensive training, was armed. On Friday night, the mother of the girls, ages 9, 8, and 5, reported that their father did not return to them after a planned visit. Over the weekend, authorities looked for the children and for Decker, who is believed to be living out of a white 2017 GMC Sierra pickup truck with Washington plates. Police said Decker's unoccupied truck was found Monday near the campground west of the city of Leavenworth, which is about 20 miles northeast of Wenatchee. Officers found the girls' bodies during a search. Anyone who may have seen Decker since Friday or knows of his current location is asked to call 911. And in lighter news, a free family-friendly literacy event is coming to Hiram Library this Saturday, June 14th, as Operation Literacy presents Readacon, a day focused on early reading, fun prizes, and family support. The event runs from 10 to 3 p.m. at the library located on 50 West Main Street in Hiram. It is open to children ages 0 to 11 and their families. Children can drop in at any time during the event to read books and earn treats and prizes for their participation. In addition to encouraging reading throughout positive play and reinforcement, Readacon will offer free dyslexia screenings for children and provide educational resources to help family address early literacy challenges. Organizers said the event is designed not just for family fun activity, but to be a part of a broader initiative to combat national literacy cycles. Operation Literacy, a nonprofit behind the event, works to improve reading outcomes through book distribution, author visits, early screening programs, and access to structured literacy tools. A look at your weather this hour brought to you by Napa Auto Parts. Visit them from your locally owned Preston to Providence stores. Sunny with a high near 74 today, tonight, mostly clear with a low around 46. That's been a look at this hour's news headlines here on KVNU. I'm J.D. Walker.
ABC News, I'm Michelle Franzen. The suspect charged in the Boulder firebombing attack at a Jewish rally is due back in court tomorrow to face more charges. Authorities say more victims came forward, and the total number of those injured has risen to 15. Mohammed Solomon's family has also been taken into custody, but a federal judge today temporarily halted their deportation.
Now, federal officials had said once they took this family into custody, they were being processed for an expedited deportation. In fact, we've seen from one member of Congress that he had said that they were were going to be deported to Egypt as soon as this week. But now, according to this judge's order, that is on hold at least temporarily until there can be some kind of hearing.
ABC's Trevor Ault. A manhunt continues for a Washington state father suspected of killing his 3 school-aged daughters after a court-ordered visitation. Authorities found the bodies were near a campground. Police say Travis Decker could be armed and dangerous. And on Wall Street, stocks ending mixed today. This is ABC News.
Do you have a nasty weed problem? We have the right person for you. Sir, you work for Logan Extermination, don't you? Can you help these folks get rid of pesky dandelions?
Of course I can help. I am the Terminator. I will terminate those little yellow devils in your yard. Call me at Logan Extermination, 752-8450.
Terminate your weeds and green up your lawn for only $45, based on maximum 5,000 square feet.
Bringing Wall Street to Main Street. From your local experts in downtown Logan, this is the Adams Wealth Advisors Market Report.
Hi, I'm Jaden May, Senior Wealth Advisor at Adams Wealth Advisors. Markets ended mixed on the day as investors digested a mixed batch of economic data and the implementation of increased tariffs on steel and aluminum imports, with the UK remaining the only country exempt from the hike. Despite the uncertain backdrop, equities showed resilience, with all major indices ending mostly flat as investors digest the information. The Dow Jones Industrial Average ticked down 0.2% to close at 42,428. The Nasdaq rose 0.3% to 19,460. And the S&P 500 stayed flat at 5,970. The Russell 2000 fell by 0.2% to finish at 2,098. Healthcare, materials, technology, and industrials led sector gains, while all other sectors closed in negative territory. In the bond market, the 10-year Treasury yield declined by 10 basis points to 4.36%, while the 30-year yield dropped about the same, falling 10 basis points to 4.88%. WTI crude oil also declined, down 1.03% on the day. Economic data was mostly negative. The May ISM Services Index showed contraction for the first time in a year, raising concerns about service sector momentum. ADP employment data surprised to the downside, pointing to weaker private hiring. This contrasted with yesterday's April JOLTS report, which showed stronger than expected job openings. The Fed's Beige Book indicated a slight slowdown in overall economic activity. Consumer spending was reported as mixed, with most Fed districts noting flat or slightly declining spending. However, some saw increased purchases of goods expected to be impacted by tariffs, suggesting front-loaded consumer behavior. Tomorrow, initial jobless claims, productivity, and U.S. trade deficit will inform the market on the most recent developments.
That's your update from Adams Wealth Advisors, guiding your financial future one day at a time. For personalized help planning yours, reach out to us at 435-752-1702. See you soon, Cache Valley. Advisory services offered through Adams Wealth Management, a registered investment advisor. For important disclosures and more information, visit adamswealthadvisors.com.
One day, one massive parking lot, thousands of deals. It's Cache Valley's biggest garage sale, June 21st, 8 a.m. to 3 p.m. at the Eccles Ice Center parking lot. It's the ultimate community yard sale with bargains galore and a kids' fun zone, food vendors, and thousands of deals to be made. Bring your stuff or bring your wallet. Whether you're a family looking to declutter or a business ready to unload inventory, there's a space for you. First come, first served. For details, sign up, and payment information, go to CacheValleyGarageSale.com. It's Cache Valley's biggest garage sale, June 21st at the Eccles Ice Center.
Hi, I'm Smokey Bear, and I made an assistant to help you prevent wildfires.
Dude, I've got this. I've been camping since I was 5 years old.
But I am a camping influencer.
You know what? I'll bet you $5. Assistant Smokey, what is the best way to put out a campfire?
To put out a campfire, drown with water, stir, drown again. Then make sure the fire is out cold by feeling with the back of your hand.
Wait, really?
I'll take the $5.
Learn more at SmokeyBear.com.
Brought to you by the U.S. Forest Service, your state forester, and the Ad Council.
I'm broke, but I'm happy. I'm poor, but I'm kind. I'm short, but
Cache County Executive David Zook joining us in hour 2 of today's show for the County Hour. We had to skip this last month due to scheduling conflicts, so Mr. Zook says he's got a double bill of information to supply this month. with a lot of construction happening countywide as well, we can talk about. So that's coming up in hour 2. We're a day late on this due to our own scheduling issues here in the studio yesterday, and basically just being a packed show. So one day late for this sneak preview of Sutherland Institute's weekly Defending Ideas show, but we still have it for our listeners, and this is good timing in a way, because yesterday we found that there was a little known, including by the people who voted for the bill, provision in the House budget bill, the big, beautiful bill that is now rolling through the Senate with the goal of them passing something by July 4th. The House, of course, has to agree. They pass the bill first, and then it heads off to the president for signature. July 4th is the target on that, but several House Republicans are making noise today after discovering the bill they voted for, apparently they didn't read, had a provision that basically nullified all rules and regulations regarding artificial intelligence passed by the states, which would include Utah, that has passed several. I don't know why this would happen other than someone with deep pockets got to someone else, because this is a silly provision. But it's in there, and hopefully the Senate, with generally cooler heads, strips it out, but we'll see. That has everybody talking about AI again, and that just Sutherland Institute's Nick Dunn decided, well, that should be the topic of this week's Defending Ideas. He sits down this week with Naomi Lopez. She is founder and principal of Nexus Policy Consulting. This is an organization that helps to inform state lawmakers on public policy decisions regarding technology. And lately, a lot of that has been geared towards artificial intelligence. But specific question that they have their conversation around this week, Nick and Naomi, is healthcare. Should artificial intelligence play a role in healthcare? Is there a productive role for it to play? What are some of the risks? What are some of the positives? In an episode titled, "The AI Doctor Will See You Now," it's this week's episode of Sutherland Institute's Defending Ideas.
And I wanted to talk to you because of the work that you've done on AI in healthcare in particular. And to kind of start off, I'd love to just get your general sense of how you view this issue broadly. Of course, whenever we start talking about AI, there's images of Terminator or the iRobot movie. I'm partial to myself, enjoyed that one. You know, all of these sci-fi depictions of AI or robots kind of rising up and destroying humanity. In real life, it's a lot more optimistic than that. There's a lot more cause for excitement, but we still want to make sure we get it right in the policy landscape. So what are your general thoughts? How do you view AI generally? And then how do you feel about it in the healthcare space? Are you excited? Are you a little nervous? Maybe a little both? What do you think?
I'm so optimistic about what AI could possibly mean for people in their everyday lives, improving their lives, making healthcare more affordable and accessible. When you think about how the internet has impacted our lives over the past couple of decades, what I predict is that AI will do that but tenfold for us in our daily lives. So, you know, whenever we're talking about the healthcare experience, what it might mean for a patient, for example, imagine an easier time scheduling your appointment with your provider. Imagine being able, in some cases, to get a remote diagnosis and a prescription filled seamlessly without a lot of rigmarole, without having to get into your car, doing it after hours. Whenever we talk about more serious illnesses, the ability of AI to diagnose and provide treatments will change very dramatically going forward. So I think that every aspect of healthcare is either already being touched by AI or will soon be. The Food and Drug Administration has already certified or approved 1,000 devices that are either AI or machine learning assisted devices. And so this is all moving very quickly. And I know that there are concerns, and of course we need to be rational about those concerns. But I think what we're going to eventually see is regulation, hopefully based on risk. For example, an AI that might be able to alert your doctor that you're an AFib, for example, because you have a wearable, is going to be a different risk level than a large language model that could develop a new and unique molecule. So that would be regulated differently. And I think that that's really the more rational approach. That's the way that we will be moving forward, especially in states that protect innovation and want to see that flourish.
Naomi, it's amazing to me that you say there are already a number of different ways that AI is impacting healthcare delivery today, and I want to get into some of those examples. But first, kind of, again, a general question. I think when regular folks out there think about healthcare, probably the thing they think about the most, the image that comes to their mind is, well, me sitting in a doctor's office, talking to my doctor, getting a checkup, talking through whatever issue I'm trying to resolve. And that interaction, it's almost kind of this iconic, almost cliche depiction of the healthcare system, right? You go in and talk to your doctor. Is AI going to change that? And I think maybe on some people's minds, the question of, well, is AI going to replace my doctor? Am I just going to, type into Chat GPT? Maybe the way we do today, we already Google our symptoms on like WebMD and try and diagnose ourselves. Are we going to do that with AI? Will it replace our doctor? Or is it just going to make my doctor better at their job?
Well, I think it might, in some cases, it might actually eventually, not today, replace some of the functions that doctors do. But I think also, very importantly, it will allow the doctor to do more of what they're supposed to be doing. They will spend less time taking notes and charting because AI can do some of those functions for them. It will allow them to be trained better in how to talk to you about your diagnosis, and perhaps showing them when they use the assistance of AI in describing your illness, the treatments, and perhaps some of your options going forward, particularly if it's a serious illness. It will assist them in that manner too. And it will also help them just spend more time with you, spend more time with the patient in the office, as opposed to frantically, running in 20 minutes late into the exam room, frantically taking notes, being distracted. It will allow them to be a doctor and do those things that they entered medicine to do.
Naomi, you wrote an article, I think it was last year, semi-recently, but in Discourse Magazine, that talks about one example of where AI could actually impact, or in this case, deliver a level of care. We'll include the link on our show notes, but the piece is called Life-Saving AI in Aisle 12. I'm going to read a brief excerpt and ask you to expand on it. You write, AI-assisted 3D mammography promises to be another significant advancement in breast imaging and screening. This technology is able to more quickly and more accurately analyze hundreds of digital breast images produced from multiple angles, offering more precise and detailed views of the breast tissue, which allows for earlier and more accurate detection of breast cancer and no increase in false positives. Can you talk about that example? I mean, that's a very specific way that AI is delivering, a level of access to care that we haven't seen before.
Yes. So when you look at what is being certified and approved by the FDA, like I said, there are more than 1,000 devices that are AI or machine learning assisted at this point in time. But the capacity of an individual radiologist to look at hundreds or thousands of pieces of data and information about your particular mammogram is just not humanly possible. Humans don't have that capacity, but they do have, a radiologist does have a lot of medical expertise. So whenever they use AI to help examine and evaluate the 3D mammogram, which has a lot more information and pieces of data than a regular one would, they are able to give a better diagnosis, detect cancer earlier, which is a key and very important factor in long-term survival of breast cancer. But also, whenever you think about this new technology, you can also pair it with what's available now. Like, for example, clinics that might be located in big box stores, like the Walmart that I spoke about in my article, where, if you think about, I had the personal experience where I had a mammogram that was scheduled in the fall and I had to reschedule. It took me like 3 or 4 months to get the next appointment. So the convenience of having it in a pop-up store, reminding women to get the mammogram, making it easier to schedule, basically a walk-in clinic, also impacts access to that really important care. And when you're talking about breast cancer in particular and other cancers, individuals who are in lower socioeconomic levels tend to not have as easy of a time in taking time off of work and scheduling those appointments, paying for those diagnostics because of out-of-pocket requirements, meaning deductibles, things of that nature. So all of these things together can really create a system where care is more accessible and in many cases more affordable. And whenever we're talking about rural care specifically, we're already seeing the impact of AI and machine learning devices. For example, individuals who have diabetes and, are being evaluated because of their eyesight might not know they have retinal myopathy right away because there is no ophthalmologist in their community. They have to travel to another place to get that diagnosis. And that often takes a lot of time. Sometimes it doesn't even happen because it's not possible or convenient enough. So now there is the technology to do that diagnosis using AI and machine learning remotely through telehealth, for example. And so those types of treatments, which were not available in rural areas, are now becoming more available. And we are seeing that in all areas of healthcare and medicine. And that's a great thing for the future of healthcare.
I mean, it seems like you're touching on kind of two things. Number one is just sort of the physical proximity to, ways to diagnose or ways to access care. And again, this idea, if I understand it correctly, if I'm in a very remote rural area and I go into the local grocery store, like you mentioned in your article, it's a Walmart, I go into some kind of place and they have, I guess, a machine of some kind that does whatever the function is, but there wouldn't necessarily be a doctor physically present. They would be in a different location, say if their office is in a bigger city. But because of the technology and because of AI being able to assist in that, I'm able to get, I assume, the same quality of care is kind of the idea. Can you talk about that? It sounds like it just increases the physical proximity to patients in ways that we have never been able to do before.
So the advent of telehealth has made that much easier, and we saw that a lot during the pandemic, where, for example, stroke patients in one state were being actually assisted by stroke specialists in another part of the country. Those telehealth rules and the federal flexibilities allowed for a lot more interstate collaboration and treatment of patients across state lines.
That was, again, a sneak preview of this week's Sutherland Institute's Defending Ideas. You can hear the whole conversation with Nick and Naomi at sutherlandinstitute.org. This kind of gets to where I'm at on this. I don't know that I would ever be comfortable going under the knife, a surgery performed by AI. I mean, AI is software. And we all know, the operating system on your laptop locks up once in a while. Imagine if that's during a surgery. So I don't know that I'd ever be comfortable with that. But in this capacity, what Nick and Naomi are talking about, you can see AI having a positive role. And I think this speaks to something we should all think of. I say this again and again. AI is not ready. Those who are pushing it are overselling it. But one day it will get where they claim it is right now. And that it can play an important role like this, offsetting or providing more access to healthcare services, even in an area that doesn't have enough doctors per residence. Some procedures, I think most people would be comfortable sitting down in a little kiosk and talking to AI software and then having that information go off to an actual human doctor for diagnosis and recommended treatment. That's a positive way AI could step into healthcare. So, again, listen to the whole episode at sutherlandinstitute.org, Defending Ideas, and we'll be back with more of For the People right after this.
ready, Cache Valley. It's time to clear out the clutter and cash in at Cache Valley's biggest garage sale, happening Saturday, June 21st from 8 a.m. to 3 p.m. at the Eccles Ice Arena parking lot. Whether you're buying or selling or just hunting for deals, you'll find everything from tools and toys to furniture and vintage finds, all in one spot. Open to individuals, families, and businesses. Space is first come, first served. Your chance to see hundreds of people to sell your valued treasures. For details, sign up, and payment information, go to CacheValleyGarageSale.com. Let the garage sale mania begin.
It's the 26th annual Northern Utah Wild Horse and Burro Festival this Friday and Saturday. The festival is located at the Desert Peak Complex in Grantsville, Utah. Be ready to take home your wild horse or burro. Adopt your horse or burro and enjoy a wild horse show and extreme challenge on Friday and Saturday. It's your chance to adopt a horse or burro this Friday and Saturday in Grantsville, Utah. For more information, go to Utah Wild Horse and Burro Festival on Facebook.
In today's day and age, getting the right information in a timely manner is essential, especially when it's about what's going on in your own neighborhoods in Logan and Hiram, in North Logan and Smithfield, in Providence and Millville, in Tremonton and Preston. Knowing the truth from trusted sources should be available to everyone in our community. Cache Valley Daily is committed to being your link to local news and sports. Know what's going on in your community. Visit CacheValleyDaily.com.
My daughter was diagnosed with a rare malignant rhabdoid tumor on the spine. They sent her straight to St. Jude. My hope was gone. But when you get there, everyone's like, hey, we're not going to give up. And when you see other people not giving up on your child, that makes all the difference in the world. When I found out I didn't have to pay, I was just grateful. They saved my baby's life.
Finding cures, saving children. Learn more at stjude.org.
Do you know a champion in our community? Nominate them for the KVNU Above and Beyond Salute. Every Friday morning at 8:30, we'll spotlight a firefighter, law enforcement officer, healthcare worker, or other deserving individual and give them a $40 gift card to Firehouse Subs. Submit your nominations for the Above and Beyond Salute by visiting kvnutalk.com. Help us recognize the champions in our communities. The Above and Beyond Salute, sponsored by Firehouse Subs on News Talk KVNU, the voice of Northern Utah.
That is it for hour one of today's show, but I hope everyone will stick around. Cache County Executive David Zook joining us at the top of hour two. We had to take last month off from the county hour due to scheduling conflicts, so he's got a double bag full of information to throw out there to keep you abreast of everything going on in the county. And if you've noticed the construction, there's quite a few projects out there. So join us, hour two of today's show with Cache County Executive David Zook right after this here on KVNU Logan.